Dr. Adams, you and I have both been in this industry for a long time, and a common concern that I hear when speaking to individuals or their families about them needing treatment, but feeling as though it's not the right time or it would be impossible to get away. For example, recently speaking with a woman who has a young child who she did not feel comfortable leaving to get away from treatment. And I know you and the team at Prospect Hill were very creative with how we could accommodate her. Do you mind sharing a little bit about that?
Yeah, absolutely, Kelly, and thank you for the question. One of the things that we pride ourselves on at Prospect Hill is finding a way to reduce the barriers that would keep anybody out of getting the care that they need. So with that particular example, we were able to work with the individual who, by the way, had a number of reasons why she didn't want to be separated from her child, both for her own mental health and wellness and for the child as well, for attachment type of issues, which is perfectly understandable. We don't want a mother or their child to be penalized or hurt in any way just because the mother is getting the kind of care that she needs for her overall health or wellness. So what we did is we allowed that person to come into treatment. She stayed here residentially with us here at Prospect Hill, and we were able to identify a local Airbnb in the area where her child was able to stay with a companion that stayed with the child the whole time. And one of the things that was really great about it is that the companion was able to bring the child back and forth from the Airbnb to Prospect Hill so that we could do some interaction between the mother and her child, and also observe how that was playing out, because even watching that interaction, being part of that interaction, was really important clinically for us to be able to figure out how that informs our treatment plans.
What a beautiful gift for both the mother and her child. Another example that comes up very often is, I know I need to take a break, I know I need help, but I can't because of work. I can't get away, too much going on, board meetings, reports that are due, my team needs me. How does Prospect Hill handle those types of scenarios?
That's a really challenging one, and we get a lot of people that have that rationale, and we get a lot of people with those type A personalities that feel like they don't want to leave their career. That's a very big part of their identity, who they are. So they can't imagine actually the work functioning without them or them functioning without the work. So we come up with ways to allow our patients to work while they are in treatment. Of course, when our patients come to treatment, we want their clinical care to be their priority, but we build time into their schedule during the day so that they can have access to their electronics as clinically appropriate, so they can use their devices to keep in touch with work, stay involved, do a board meeting, do whatever they need to do, again, as long as they're prioritizing their clinical care. The other thing that I would say, though, is that when an individual presents that as a barrier, sometimes it is an indication of them just not being ready. And it's being able to talk through what are the actual issues, because sometimes it's indicative of maybe a deeper clinical issue that we have to be able to vet out.
And what would you say to the individuals that need a clinically creative option for, they know they need to engage in longer term treatment? Can you speak about the creative clinical opportunities Prospect Hill allows for when individuals need to be here for a longer amount of time than maybe they feel like they're able to be here, or in reality they do have commitments, situations back home that they need to attend to during the course of their stay?
Sure. I mean, one of the things that we know just from research and data is that the longer somebody can stay in treatment, the better the outcomes. So we know up front that sometimes when people are trying to negotiate just a 2-week stay, or even sometimes a 30-week stay, a 30-day stay, when they've have some serious mental health issues and dependence on drugs or alcohol, we know they're going to need longer. We can be creative when it comes to what their needs are outside of their treatment experience. So if someone's saying they're only going to stay for 2 weeks because they have to go for the birth of their grandchild, or some kind of work event, retirement, something that's coming up that is a big planned thing in their life, we can work with that. we actually don't see that as a barrier. We see that as a clinical opportunity. Sometimes what we'll do is, rather than say, okay, 2 weeks and you're done, we'll say, okay, go ahead, go home for that event. We might provide some support in getting there, some way to keep that individual safe and healthy while they're there. So we're creative around solutions for that. But we also want to use that to determine if they go home, then come back, what was that experience like? Even if it was after 2 weeks or after 30 days, they're looking at life through a different lens. They now have a sober lens. They have a little bit of recovery, mental health support under their belt, and they're going to see things differently. Relationships are starting to change. The way that their family responds to them will change or has not changed. And so that often provides a lot of rich clinical information for the patient to bring back. It's very often that they say, oh, I thought that I was going to be done in 2 weeks, but now that I've gone home and I've had this experience, I see some of the other work that I need to do, and they start to realize it's not just about the substance or their drug of choice, it's also about the dysfunction that was in their life, sometimes as a result of their mental health issue or of the substance, but then they can come back, and usually they have a different level of readiness to work with all of those issues and concerns and allow us to give them the clinical support that they need for a longer length of stay.
One of the concerns I've heard many times over the past 20 years is I can't go to treatment because what will I tell people? What will people think? And while we'd like to believe that we have decreased the stigma when it comes to mental health treatment, substance use disorder treatment, we also know that that is still a valid concern based on your community, based on your relationships, based on your career. What would you say to the individuals that are fearful of going to treatment and what people would think?
That's a really interesting question, because sometimes it's just about taking that step through the door and figuring some of that out once you start getting the care, because the way you feel about it before you get care might be different than the way you feel about it a week or 2 weeks or 3 weeks into care. So for example, a lot of people that need treatment, if they've ever gone to a meeting or they've got support from someone else, someone will say, well, you're only as sick as your secrets. So people feel compelled, I'm doing something deceitful if I'm not telling the truth about where I'm going or what I'm doing. But the fact is, somebody's health care and the way that they choose to get health care is a private and personal decision. And a lot of people will struggle, especially if they've got a reputation for work or other things. It'd be ideal if we didn't have to face the stigma of that and everybody could just be upfront and honest with whatever their situation is. But that's a luxury that's not afforded to absolutely everyone. So what I generally say is make the decision, come to treatment, and allow us to break that down for you and work through it step by step to see what you are comfortable with. Because when somebody comes into treatment, they're often coming in with a serious amount of shame and guilt. And those are clinical issues that, I just can't say, okay, well, tell your employer this or don't tell them that, right? What we really have to do is look at what is the issue underneath. Why are they feeling such shame? Where does that come from? And how does that feed into the stigma? So once we get somebody in the door and we can begin that clinical work, we can begin to unpack that. And if we can target the shame that they're feeling and experiencing, some of that stuff are actually clinical issues that lie underneath the compulsion to drink or cope with drugs or alcohol to begin with. So that's the work that we want to do. So some of those decisions aren't made on day one or even before somebody gets there. We like to be able to hold our patients and be able to help them make the decisions that work best for them when it comes to the disclosures that are important as that in their lives.
And to your point, everyone's situation is different, but some of the favorite phone calls I've received during my time in this field is the individuals who were fearful to go to treatment for the stigma of what would people think, what am I going to tell people, when they, or if they are comfortable getting vulnerable and sharing. I've loved receiving the calls of, I was so scared. I was so scared to tell people what I had done. I was afraid that people would think of me differently or they would judge me. And in reality, when I shared with them, they then got vulnerable, whether it was about their own struggles, a family member's struggles, a loved one's struggles, and it opens the door for people to be able to speak openly and honestly in a way that does break down those barriers. It does decrease the stigma and shows us that we're all human. Everyone needs help sometimes.
Right. And we all need our safe places. We all need our safe circle of people. I think Brene Brown calls it the square squad, the people that you can really trust in your life. And sometimes you start with those people and you make those disclosures. And you mentioned the stigma. I can't blame somebody for having fears about telling people that they're going to treatment in this age of social media where everything is exploited on information. And fortunately, when you're here at a place like Prospect Hill and you're getting clinical support, you can get support around who do you feel like you want to make that disclosure to, who's your square squad, who are the people that you're trusting, and how. Sometimes it's actually been in a clinical session that we've supported someone in calling a family member or a loved one. And part of what is also difficult for many individuals, not just making the disclosure that they need help, they need help, it's actually not just the help that they need from us, but it's help from loved ones, and being able to ask them and be vulnerable with them. So you're right, that's absolutely a beautiful thing, because once we support our clients in being able to make those disclosures, they often get that unconditional love back, which is something that they were afraid that they weren't going to have.
Oftentimes, individuals are also fearful of leaving a relationship, whether it's a new relationship or an old relationship. For different reasons, I'm fearful of leaving my significant other, my spouse, stepping away. What does that mean for my relationship? How will I stay connected? What's your experience been with those individual concerns?
My experience with that is that many individuals are afraid of change when it comes to the relationship in general, and sometimes the very reason that they need to come to treatment are issues related to the relationship. Sometimes that relationship is actually something that is fueling their maladaptive behaviors, like drugs or alcohol. And generally what I find is most people are afraid, if I change or I'm different when I come back, that person's not going to love me, that person's not going to be there for me. What if they break up with me? What if the relationship ends? And I like to ask those individuals that have those fears, but what if you don't do this, right? So, if you're not getting well, then your relationship probably has a much smaller chance of surviving anyway, right? So if you really want to give that relationship the best chance at survival, let's not only get you the care that you need, but let's consider if this relationship is important to you and you want things to work out, how can that person that you're in the relationship with be a part of your care? And by the way, people don't get well in a vacuum. So while someone might be the person that is identified to come to care, when they're in a relationship, that person may unwittingly be part of what's perpetuating the problem. It might even be more serious than being unwitting. But how do we involve that person to give them the support and care that they need also, so that everybody gets well and it's not just targeting the needs of one specific person? And when you can do that, that's actually another thing that gives the relationship the best chance at survival.
Can you speak to the fear of the unknown, the fear of a diagnosis, the fear of having a label that may be with you for the rest of your life?
Yeah, that's a really interesting question, because sometimes people are very afraid of that, and sometimes people really look for that. I find that actually a lot of people appreciate the opportunity to get the diagnosis, and by the way, we do neuropsychological assessments within the first couple of days of our care so that we can provide a framework for understanding not just what the substance use disorder is, but what are the mental health components, what are the neuropsychological components that might be activated in the situation that's playing a part of the clinical presentation. And once we have that framework, we're able to make some determinations on a treatment plan to be able to work with whatever those specific issues are. But it can be scary that somebody gets a diagnosis because they're afraid of what that means. And we also work with them in the sense that knowledge is power, and if we do know what we're up against, we then have some ways of looking at, well, how can we treat this, because we're familiar with knowing how to do it. Now, everybody's unique they're all individuals, as far as how they present, but certainly understanding a diagnosis gives us a framework to work with. But I think it's really just the same as what I had mentioned earlier, that knowledge is power. So if you're afraid of the diagnosis, let's go underneath that and find out, what are you really afraid of? What does that mean? Is it the stigma of having a specific diagnosis, or are you afraid that there's something in your life that you want, that you're passionate about, that you won't be able to accomplish because that will inhibit you? Are you afraid that someone's not going to love you because you have a specific diagnosis? Because in general, none of those things are ever really true. Those are our fears and anxieties and other things at play that cause us to act out in maladaptive coping mechanisms anyway. So I think those very fears, when people express them as part of, well, I'm afraid of the diagnosis, those are the fears that we're trying to work with to get underneath what's really going on, what's the significant clinical issue underneath it.
When we know better, we do better.
Right, exactly.
At Prospect Hill, we're able to treat individuals with primary mental health concerns. We're able to treat individuals with primary substance use disorders. Oftentimes, our clients may be experiencing both. But when we have the clients who are coming in specifically for trauma work and they don't have any type of substance use disorder, oftentimes I find that they are fearful about being in a small milieu with other clients who may have different diagnoses than them, that may have walked in these doors for a different reason, and also vice versa. Clients who have substance use disorders and are maybe fearful about being in treatment with individuals who might not be able to relate specifically to that struggle. What would you say to these clients?
I'd say that there's a bit of a double-edged sword there that's very interesting, because a great number of patients, and it is very often that our patients have an array of differences between them. But I think the interesting thing is that that's sort of a microcosm of life also. I mean, if you're at work or you're at school or you're in a family, not everybody has exactly what you have. Not everybody thinks the way you think or behaves the way that you behave. So actually, to be in an environment where there's varying types of people, varying types of presentations, it's really reflective of what you experience in the world. And what we actually want is as close to a life on life terms experience while you're in treatment, so that we can see how you do in those settings. So if you don't do well and you're stimulated in a certain way that's activating some kind of anxiety or something else, then that's a clinical issue that you would face out in the world beyond treatment as well. So we'd rather see that play out here, where we can get underneath it, figure it out, and give you the skills to be able to deal with that and cope with it. On the other hand, the other thing that I would say is, while it is clinically rich to be in an environment where you have people that are very different from you, I wouldn't assume that just because somebody doesn't have substance use disorder and that you have trauma and absent a substance use disorder, that you're very different, right? Because sometimes what's different is just the way it manifests, and the way that you respond to it, the way that you behave. So a person with trauma may not be using substance use disorder, substances to medicate that trauma, but that doesn't mean that the other person doesn't have also serious trauma, right? So we don't spend a lot of time actually in group speaking about the war stories of what it's like when somebody is engaged in substance use disorder and using those particular substances. For all of our patients, we're actually in the group environment talking about the process underneath, the mental health pieces. A lot of our patients have mental health issues that co-occur with substance use disorder, depression, anxiety, sometimes bipolar, family of origin issues, trauma. These are all very common things that are lying underneath the need for people to cope maladaptively with drugs or alcohol. So I find that for most people that are afraid, well, everybody's going to be different from me, they actually find more in common with each other than they find different.
Dr. Adams, oftentimes when people think of going to treatment, they think that's for individuals who are struggling with severe mental health concerns. They think of it for people who are struggling with substance use disorders. Tell us how Prospect Hill is able to meet the needs of individuals that are maybe at a place in their life where they are lacking purpose and passion. Maybe they've recently retired, feel like they no longer know who they are. What is my purpose? What do I do each day? Maybe it's for individuals who have suffered a significant loss and have unresolved grief and loss issues. Maybe it's for individuals who have gone through a very traumatic situation and they were able to push it down for a long time and it just keeps coming back up. So they don't necessarily identify with having mental health diagnoses or any type of substance use disorder, but they're wondering, can they benefit from being in this type of environment?
Yes, Kelly, I think we've had a number of patients that that meet that exact description that you mentioned in many of those ways. So you mentioned, several different kinds of presentations, but it's often that we see, particularly with people that are going through different life kind of transitions, that they're stuck in their life. So it might not be an extreme, mental health issue, but there could be professional burnout. There could be exhaustion. There could be that sense of, an existential crisis where, I was connected to something before. I no longer, feel the joy out of what I did before, and maybe I need to recreate myself, reinvent myself. And sometimes it's about going on a journey, starting a new journey, and being able to have some time away to be in a place where you're cared for by clinical professionals that can help you reignite that passion and that purpose. So we often see that with people that are selling a business, that are retiring from a long-term career, that just want to start something new. Sometimes we see it with individuals that are in relationship transition. They've left a long-term relationship. They hope to start another relationship but don't necessarily feel ready and maybe want to do some work on themselves before they do that. And then there's people that have actually, lost someone significant in their life and they're suffering those issues of grief and loss, and they, want to have a place, a safe place to be around other people that can provide them community and a sense of support, but take them out of their life, take them out of that familiarity with the people, places, and things that, can be wonderful in some ways, but can also interfere with their own creative process and their own ability to connect to themselves. So what I say for those individuals is, why not come here to a place that is the most healing environment that I've ever seen here in St. Croix, be a part of Prospect Hill, and let our staff be able to hold you through that experience while you do that self-examination, have a bit of a respite for yourself, and reconnect with your own inner self, your own spirituality, your own sense of purpose.
As always, Dr. Adams, it's a pleasure speaking with you. Thank you so much, and appreciate everything you do for our clients and their families.
Thank you, Kelly.